Okay, good morning, everybody, or good afternoon on Carly's side of the world. I am Dr. Ruth Reisman, an audiologist and professor here at New York City, in New York City. Today, we are going to be recording episode 15 of the Happy Hearing podcast, and I'm looking forward to just retelling my story about my hearing loss and then listening and asking questions of my co-host's story as well. So, Carly, welcome back, and it's good to see you again. And just reintroduce yourself and any questions that you have, I'm happy to answer, and vice versa.
Yeah, hi everyone, and hi Ruth. Welcome to the Happy Hearing Podcast, episode 15. I'm Carly Sygrove, a hearing loss coach, advocate, and writer. So, as Dr. Ruth Reisman has said, we are going to share a little bit more of our hearing loss stories today because a listener actually reached out and asked us, they wanted to know some more about what happened to us and how our hearing is today and our tinnitus as well. So, Ruth, I know little snippets of your story, and I know we have some similarities in our hearing loss experiences. So, I'm just wondering if you'd like to start by telling us just a little bit about your hearing loss experience and what it entailed.
Yeah, for sure. So I did have, it was back in 2019 where I experienced sudden hearing loss in my left ear. It's really interesting because as an audiologist who's very attuned to hearing, I really did not put two and two together. I was getting really dizzy. I had this crazy roaring tinnitus. And then every time my son was younger at the time, so I guess he was about 2 years old. And I started to notice every time he cried, I would get this really intense vibrations in my ear and sensitivity. And I didn't really understand what was going on until I was took a phone call and I brought it to my left ear and I'm like, wait, something's not working. I'm not hearing anything. It's not I don't hear the dial tone. I don't hear it ringing. And then once it started ringing or someone got on and they were speaking really loudly, I heard really distorted and my eardrum started vibrating. It was really uncomfortable. So I switched to the other side and noticed that it was much clearer and more comfortable. And I kept going back and forth. And I'm like, wow, I lost something is not right here. And it's funny that I didn't put two and two together, given that I was dizzy, not just that day, it was going on for a few days. And I was having the tinnitus. So it's funny. It's like the doctor who, the foot doctor who has the wrong shoes or all of those
Hmm.
funny cliches. That's kind of exactly what was happening to me. And then,
Hmm.
thankfully it was a Sunday, I recall, because the following day I went back to work. And the first thing that I did in the morning was told my colleagues, I'm like, I really think I'm not hearing well. Something's going on. Can somebody test my hearing? And as they were testing me, like you could see that their face was getting more and more worried. And they're like, they would respond in the booth and say like, are you really not hearing that? Remember, respond to the lowest tone. I'm like, I know how to do this, but then I pretty much had like a moderately severe to severe hearing loss in my left ear, which was obviously very concerning considering the field that I'm in and that it happened all of a sudden, and I was experiencing all of these symptoms. So thankfully, I worked at the hospital at the time, so I got care immediately in terms of all of the assessments and anything that is typically done for a sudden sensory neural hearing loss, which is giving oral steroids and a steroid injection. But it still wasn't clear if it was just an idiopathic, meaning no reason behind the sudden sensory neural hearing loss, or potentially something else was going on. So, or was it an after? So what happened was there was a few theories because I still am not sure what caused it, but the year prior, I had a really bad head injury. I was doing construction in my home and I had fallen down the steps and split open my head. And I wasn't sure if it was some sort of aftermath from that or something else was going on. Um, but yeah, they did a lot of testing. So typical testing when sudden sensory neural hearing loss, and I'm sure Carly, you can relate. They had to do some imaging to make sure that there wasn't something significant going on. So typically when they do these imaging, they're looking for things like, God forbid, a stroke, a tumor, anything else that could be impeding on the hearing nerve. And I remember sitting at the MRI in the MRI room, and in my typical nature, I was laughing with the MRI tech and we were having a good time. And he's like, okay, I'm just going to go back and get the room ready and then come back. And then I I don't know why they had this in the waiting room, but there was some sort of article about a woman who had cancer and how she went through cancer. And then he came back and I was crying in tears and he's like, "What happened?" He got all nervous and then, the fear started to set in, like, what are they going to find on these imaging? And even though, like, knowing with my background that usually really severe or significant findings are almost slim to none, just that chance kind of gave me a lot of stress and anxiety surrounding it.
Mm-hmm. Mm-hmm. And so a few things. I'm really interested that firstly that you, even as an audiologist, didn't, like you say, put two and two together, because it just shows that even if you are specializing in something, you don't always think these things can happen to you. I think you can sometimes be removed from maybe what you're dealing with in a profession, and when it comes to your own personal life and health, you don't always notice these things, or put two and two together and realize what's happening. So it's really interesting you said that. And so you said you had like the standard treatment, so I'm guessing you had the corticosteroid treatment as well. So what happened? Like, how are you now? And did you get your hearing back? How's the tinnitus? What happened in that time when you were taking the medicine and afterwards?
Yeah, and I think it was, so again, there was a lot of, although, like you said, there's in some ways it becomes so commonplace when you're diagnosing
Mm,
hearing loss all the time. And you do unfortunately start to lose some of the sensitivity. And this
mm,
was a big wake-up call for me to restore my sensitivity for the patients and understanding what they're going through and the stressors and the anxiety that comes along with it. Because there's no way to understand how someone feels about their hearing until you experience it yourself. So it
mhm,
was a huge wake up call. And now it's like, my sensitivity for my patients have increased so
mm,
much. And I could really relate to what they're going through and the stress and anxiety that comes along with it. But yeah, so I recall, being put in the chair. They anesthetized my ear, which was an experience within itself.
mhm,
And not knowing how patients really feel when they're going through this, that it's cold, it's painful, it's
mhm,
uncomfortable, it feels like so much pressure in your ear, just something so unnatural.
mhm,
And we did it all the time, thinking like, okay, so it's just another, ear injection, and but it's not. It's really, every person is so unique,
mhm,
and what they experience going through that is really fear inducing and
mhm,
stress inducing. So I did go through the injection, which actually in the initial, and I had the oral steroid. In the initial phase, your hearing actually goes down because they're filling your ear with fluid. So now it's like almost like you have an ear infection,
mhm,
in a way. So I felt even more disoriented. It made everything real much worse. The tinnitus was really like this roaring low frequency tinnitus.
mhm,
Um, and a lot of people at work thought I was ignoring them because it happened so suddenly. It
mhm,
is this invisible, disorder, unfortunately. And so I'd be sitting at my desk and people are trying to talk to me or ask me questions. And behind me, there was a copy machine. And anytime someone was copying, so my good ear was completely masked out. So I would hear nobody. And
Mhm.
and people started to get annoyed with me. They're like, "Are you ignoring me? I've been calling you for like 10 minutes." So they come and like tap me on the shoulder. It was very strange, to the point where I had asked the physician, like, "I know I just got the injection. Can I wear a hearing aid in the interim? Because it's really uncomfortable for me." I couldn't even go into the booth. So it's this, because the booth is so silent and so
Mm.
deafening, that my tinnitus would just it be enhanced every time I stepped in there. And I was so distracted by it that even giving patients instructions or asking them their case history was very difficult, because I couldn't focus. I was so distracted by the tinnitus that thankfully we had a lot of residents and interns that rotated through the hospital. So until I was able to get better, they had to go into the booth and do the case history, and I would just listen in when I could. Um, so it went on for about 2 months where I couldn't hear, and I had this tinnitus until one day I started to feel like things started to let up a little bit, and it felt like it was getting better. The dizziness went away and the tinnitus was getting softer. So I had a sense that, okay, maybe things were getting better. They checked my hearing, and at that point I was in the mild range. So once we start to see some improvement, then there's hope that we could get a full resolution.
Mm.
Um, it might have been because of the medication. It might have also been from wearing the hearing aid that I made sure that the ear was still getting the stimulation. There's some research that shows that
Mm.
wearing the hearing aid early on does keep the nerve stimulated, and can sometimes restore some of the hearing. So I, of course, adjusted the hearing aid and then kept getting hearing tests every month. And I think by month 4, the hearing levels completely resolved. But there is always this reminder, this residual symptoms that keep me conscious of the fact that there was something going on with that ear, which includes dizziness. So from time to time, I'll still get some sort of vertigo. It does correlate to either salt intake or alcohol intake, which, is consistent with some sort of Meniere's type of symptom. It could be also that the head injury, maybe I had some sort of fracture in the inner ear that causes like a third window syndrome, like a imbalance of fluid again in the inner ear, just like Meniere's. So I don't know if that is the cause of it. But what's really interesting is that I always had this fear that I was going to lose my hearing, because my mother, and I think we spoke about how I got into the field of audiology. My mother had otosclerosis in both of her ears and had a severe to profound hearing loss in both ears until she had gone for surgery and recovered most of her hearing. And because I knew from studying that that was genetic, I always had this anxiety like, oh, I'm going to lose my hearing. And every time I had a pregnancy or some sort of change in life, I was like, oh, maybe I'm losing my hearing. Let me check it. So
Mm.
it was kind of ironic that it happened, but it was a completely different cause, and it's still not clear 100% what happened or what is happening with my ear. But it's definitely increased my sensitivity, heightened my awareness of, what could happen to the ear and how much that really impacts your day-to-day life.
Mm. Definitely. So since 2019, when this happened, have you had any other issues with your ear, or has it been stable since you recovered?
Yeah, so the hearing levels have been pretty much stable.
Mhm.
There are times, I think, that I explained that my ear will get full, or I'll get some
Mhm.
dizziness, some tinnitus will come back to, or distortion. That still stayed when I hear a very loud sound, or if
Mm.
there's a very loud ringtone on a
Mhm.
phone, I'll still get some distortion in the left ear, which means that something is still going on with the ear. It's not fully recovered.
Mhm.
But at this point, I just keep an eye on it and monitor it and check my hearing every year to make sure, and even more consistently because I do a lot of checking of equipment and so on and so forth. But just to make sure that things stay stable for the most part.
Mhm. Mhm. Um, I'm thinking about all your patients and thinking how lucky they are to have somebody who actually understands this and who can actually, you said maybe some of your sensitivity before this happened had kind of, maybe you'd kind of lost a little bit of that until this happened. And now you've been in this position where you can completely put yourself in somebody's shoes if they're having a hearing loss or a sudden hearing loss, and knowing like how that feels. And just if I was a patient, I'd feel really lucky to have somebody who understands, because I've been to so many specialists who you can see are just, I'm just another number. I'm just somebody, you know walking through their door. I'm just, another few minutes in their day to them. I'm not actually. I think sometimes it is easy for people to lose sensitivity whatever job you're doing, because it's the same. It can be the same day in, day out. So yeah, your patients must. If they know your story, maybe they're listening now, must really appreciate that, and having somebody who understands.
Yeah, I think it definitely um I got to walk in the life of any one of my patients who experience hearing loss, tinnitus, or dizziness.
Mm,
So I can truly understand how they feel and in some ways um, address the stressors and the anxieties that they go through. Um, it's interesting. It's really interesting. Even something as simple as like new parents that
mm,
feel like their hearing has gone down, or all of a sudden they start getting tinnitus. Um, and and I'll tell them, like, sometimes when there are times of high stress, and that could have been a cause as well. I was unfortunately going through a really stressful time in life. It could have been my immunity was down, and that's what made me susceptible potentially to an infection or something like that.
mm,
And I'll get a lot of young adults in very stressful jobs, or new parents, that individuals that are becoming new parents, that all of a sudden come in, their hearing has changed, there's tinnitus, they're getting headaches, they're getting dizzy. And when I'll delve in just a little bit into what tell me what's going on
mhm,
in your day-to-day life. And so it's completely moving away from your ear history.
mhm,
They'll tell me, oh, I just had a new baby, I just started a new job, there were on a major deadline, and so on and so forth. And there's a lot of correlations between stressful times in life and potential decline in hearing or tinnitus, or even attention. Sometimes it's not
mm,
hearing, it's just that their attention is so divided now that they have difficulty focusing on conversations. And so they
mhm,
think their hearing has gone down, but it's really just we have a limited reserve for attention in general, or cognitive abilities.
mm,
And so when our attention is divided with other things that are really taking over our day-to-day life, we'll see that you may feel like you're experiencing hearing loss, but it's not really that. It's just your attention is somewhat divided.
mm, mm. Yeah, I'm thinking, since my hearing loss, it is more difficult to have that attention in conversation. But I understand what you're saying as well, because when you've got more than one thing happening in your life and you're thinking about lots of other things, again, your attention can be compromised. So there's a lot of reasons for that difficulty focusing and having attention. I just want to
Yeah.
quickly go back to something you said earlier. So you said your hearing started recovering within a couple of months. So was that after you'd actually finished the treatment?
So yes, it was after having gone through, typically it's 3 injections
Mm,
and a course or two of oral steroids. I went through one course of oral steroids
mhm,
and 2 injections until I started to see that the hearing improved. And even with those though, with the medication, it's like really chance. It's a 50-50. If you look at all the studies, I mean, it's a 50-50 chance that that's even going to assist in the hearing. So I don't know if it was that, or if it
Mm.
was, if it was truly something viral that now my body was kind of recovering from.
Mm.
Um, but yeah, it was essentially after the treatment, which it does not go without any side effects. So I'll tell you, even today, I have this, I think it looks like a scar. So I obviously teach in the university, so we're with the students, we're constantly looking at each other's ears and everyone's scared to go into the ear. So I'm usually the guinea pig. And I didn't even realize, like, just recently we went into like a video otoscope, and the students were looking in my ears, and I'm like, what is that? What's on my ear? And I see this like little red, it looks like a beauty. Um, and I at first I was like, what is that growth on my ear? It looks so strange. And then after, obviously, then you connect the dots, and I'm like, oh, that's probably where the injection site was, because you never really look at the ear under such a microscopic view
Mm.
when you're in the clinic. And then I started to realize also, when they did real ear measures, so when they're testing hearing aids to make sure that they're meeting the prescription levels for patients. So again, I'll be the guinea pig for the students and guide them on how to do it. And they would put the probe in my ear, which is like a little microphone, and I jumped to no end. Like, it was so painful,
Mm.
even though on the other side where I don't have that, it's not that. So like I said, there's always a residual reminder that something is going on with that
Mm.
ear,
Mm.
that I just have to be mindful of.
And just take care of it and keep the stress levels down as much as possible. And yeah,
For
I,
sure.
I think it's really nice just hearing your story, because I'm contacted by so many people who stories are different, who don't have as positive hearing outcome. So maybe, many people don't recover their hearing, like you said, and that can lead to lots of other mm, situations and difficulties, such as, just confidence and all sorts of things like anxiety. And there's a lot that comes with hearing loss. And it's so nice to hear a story that actually, has a happy hearing ending,
Hmm.
because I don't hear a lot of them. So yeah, hopefully your story will actually give some of our listeners a little bit of a confidence boost, a bit of a push, a bit of, a bit of hope if they are going through something like this.
Yeah. And I'd be curious to know, like, as much as I know, like you said, about your story, or little snippets of your story that we
Mm,
match on our left ears being the
yeah.
problematic ears, and but I know that we kind of had a different path. So I'd be curious to know, when you first started to notice that your hearing went down and what your journey was at the time.
Mm. Um, so mine was nearly 8 years ago. It's nearly my hearing loss anniversary.
Mm.
So it was 2016. I was teaching. I was busy. It was the end of the summer holiday though. So we were just talking before this podcast about the stress you get at the end of the summer holiday, knowing that you're going to go back into a classroom or back into work. So I was kind of going through that stress of getting ready for a new class, getting ready for a new school year. I was meeting the new children, the new parents of those children. I was busy, and I was awake. Many people lose their hearing suddenly when they're sleeping. For me, it wasn't. I was awake. We had a teacher training day. I was just sitting in a lecture theatre, and I was writing some notes. So I had my head down and I was writing some notes. When I put my head up, that's when I just had this feeling of pressure in my head and my ear. Everything was spinning, so I now know that was vertigo. So everything was spinning around me. I had a screeching sound in my head, which died down to be my tinnitus, which is what I have now. And that, I think, was the moment I lost my hearing. But at the time, I didn't know that had happened. I just knew something isn't right. I'm feeling I'm not feeling good. Things are spinning. I'm feeling sick. I couldn't hear anybody on my left side, and that's confusing. And I thought, oh, maybe because it's a busy lecture theatre, it's noisy, and so I knew something wasn't right. And then trying to go to the toilet in the break, I had to lean against the wall. I was holding myself up on the wall, thinking something's not right. I don't know. I carried on because teachers tend to carry on.
Mm-hmm.
And I did carry on for a few days. And I would, when there was nobody in my classroom, I'd lie on the floor and try and just recalibrate. I couldn't hear properly. I think it was about 3 days after this event in the lecture theatre where I realised the extent of how much I couldn't hear. And it was when I was on the way to work and I was on a metro train and I was listening to a podcast, and I took out let me get this right, I took out the right earphone to listen to the public announcement that was on the train. It was like, the train has stalled. You have, it's going to be a few minutes. So I took it out, I listened to it. And then before putting that earphone back in, I was like, why can't I hear my podcast? I was listening to the podcast. It was a storytelling podcast. I was really into the story. I was like, what's going on? I've missed part of this story. And then they were really old earbuds. So I was playing around with them and thinking, it's probably just that one, that side that's broken. And then I realized after playing them around with them, it wasn't like the earbud that was broken. It was my ear that just wasn't working at all. And I think that's when I started to worry. I didn't seek medical attention soon enough. So at that point, I made a doctor's appointment, which wasn't until 8 days after the hearing loss. The doctor misdiagnosed me and said, maybe there's some inflammation, your ear's fine,
Ear infection.
ear infection, yeah, something like that. So she gave me some ibuprofen and some nasal spray, and she said, come back in a week if things aren't any good. A week later, I was the same. The vertigo had started to calm down, but I still couldn't hear anything. The tinnitus was there. At that point, when I went back, she made an appointment for me to see an ENT specialist in a local health centre. I went there 18 days after my hearing loss, at which point I had my first hearing test. And the audiologist, she was so sweet. She was this little Spanish woman. She was like adorable. And I couldn't hear anything in this big center. I was really disorientated. And after the hearing test, she held my arm and she walked me to the exit and she said, you need to go to the hospital right now. She said, and she handed me my audiogram. She said, take this. And she wrote me a note in Spanish. She said, take this. And I was still just like in the early days of learning Spanish. And I didn't know where the hospital was. I didn't know what hospital, this was alien to me. So that day I went to the hospital, and that's when I was diagnosed with sudden sensory neural hearing loss. So yeah, I was in the hospital for a week. I never went to go home. Like, I was supposed to go home, and then they said, no, you need to stay. I think they really wanted to try and help. So I had intravenous corticosteroids, which is quite rare to have, and then a tapering dose of the pills. And I also had the steroid injections that you were talking about, Ruth. So I had 3 of those as well, and nothing changed at all. But as you said, there's no guarantee, even if you do get your medication, that it will work. So for me, I know I should have got help immediately now. And, this is what I tell everyone: go immediately, see somebody, get an audiogram, get the medicine, fight for yourself. Because, if you don't make a fuss, not everyone knows about this, even in the medical profession, or it's not always apparent that it could be sudden hearing loss, which is an emergency. So I always make sure that I tell people, just fight, fight for yourself, be heard. It's hard. You're going through a lot of stress. It can be difficult. Take somebody with you if you need that, that help. But it's so important because, like we were talking about earlier, when you have this hearing loss and you're living with it and it's new as well, it's not just your hearing you lose. You maybe lose. For me, I have balance issues. I've been diagnosed with Meniere's disease and vestibular migraine since then. I have a lot of difficult days. So not only am I dealing with a hearing loss, I have the difficult days that come with it, with a balance. I have tinnitus. In the beginning, I had no confidence. I lost all my confidence. I changed career because of this, not because of the hearing loss itself, but the dizziness that came with it. So hearing loss isn't just hearing loss. It's so much more. And I think that's important for people to understand, especially if they've never had it. It's those times feeling lonely in restaurants when you can't hear anybody. I have sound sensitivity, so it's not being able to go to places with lots of noise. And in our culture, fun times, like I'm in Spain, fiestas, they're noisy. Fun times are noisy, fun times are busy, and it means that you do miss out on some of the fun as well, which is not great.
Yeah, can be difficult. It's
Mm-hmm.
interesting though, in our shared story is one that we didn't really put two and two together, that something was going on with our
Yeah,
ear,
yeah,
and that the more prominent symptom for us was the dizziness and the tinnitus,
yeah,
which is
exactly.
which is something interesting to share
Mm-hmm.
because like yourself, I always tell individuals or patients, if something changes with your hearing,
Mm.
you come back right away. Even though
Yeah.
right now, let's say I'm telling you your hearing is normal, or, if something changes, you come back. But now
Mm-hmm.
I think I have to change my counseling to say, even if you notice dizziness or
Yeah.
ringing in the ear, not necessarily hearing loss, you
Mm-hmm.
should seek help, because that could potentially be an ear emergency, because those seem to be the more prevalent or disturbing symptoms, maybe, until we
Mm-hmm.
realize that something isn't going on with the hearing, and that might be the last step. And in both of our stories, that seems like it was the last step that we
Exactly.
realized.
No, exactly. And not everyone does have tinnitus with sudden hearing loss or balance issues or dizziness. But when you do have them, like you said, it's often the most prominent. And, when your world is spinning around you, you're going to pay attention to that rather than the fact that, oh, maybe you just didn't hear somebody very well for a minute. It's definitely something to be aware of, any kind of dizziness in terms of ear issues and conditions, isn't it?
Yeah. So, as I guess after this happened, what were like the next phases, I guess? Was there any recovery at all of the hearing, or?
There is no recovery, so my hearing loss is profound. Um, so I don't have basically any useful hearing on the left side. Occasionally, I can hear really high pitched emergency vehicle sirens, and that's painful. I do have hypoacusis, which basically is a sensitivity to noise. I feel it's in my deaf ear, but I feel like my hearing ear, I don't know. I feel like maybe, I'm anxious around loud noises as well because I don't want anything to harm my good ear. So there's probably something there with that. Um, so yeah, no hearing recovery. I tried a cross hearing aid, um, which basically you wear a device on both ears that look like hearing aids, and the cross hearing aid will pick up sound from your deaf side, and via Bluetooth will send it to your hearing ear. For me, the device, I didn't find it helpful. I felt like my good ear was overwhelmed with sound, and it just was not helpful. But saying that, some people do find this helpful. So please you only know if hearing instruments are going to help you if you try them. So give it a try if you're considering the cross. For me, it didn't help. And then, so basically, for 8 years, I've been living with single-sided deafness, unaided.
Mhm. And I know that you're upcoming, you're looking to get a cochlear implant, and that's coming in the very near future.
Mm-hmm.
What did the surgeon say about the probability or the likelihood of the implant working after all these years?
Mm-hmm. Yeah, so there's research out there that shows that time is of the essence as well with getting fitted with a cochlear implant. So, the sooner the better, really, following hearing loss. In my case, this is something I've wanted since I knew about cochlear implants, which was a long time ago. But the healthcare system here in Spain, it's not been available until recently to have a cochlear implant for single-sided deafness, only if you're profound in both ears or severe hearing loss in both ears. But recently, it's becoming a bit more normal. People are starting to do it. The surgeon has told me there's no guarantees. They've
Okay.
told me, it's interesting what they've told me. Every time I go there, it's something different. Last time it was, oh, it might help with your tinnitus. I'm like, okay, I'm aware of that, but that's great, because I still do have tinnitus. But for me, it's not my main aim from the implant, um, which is to have that feel. For me, the main aim is that feeling of sound. Something happens when you lose all of the hearing in one ear. That's, it's a loss of sense, but there's like this feeling that comes with having sound in that ear, which, the thought of being able to have that again would be absolutely amazing. And try not to get too excited, because I know that the outcome might not be great. On the other hand, another specialist said to me, oh, I've had patients who've had 85% word recognition, like, who've had the operation a lot later, like you. And it's really dependent on, your hearing loss, the way you rehab as well. So the exercises you do following having a cochlear implant. So there's lots of variables here. And I think while we're talking about cochlear implants, it's important to mention that it's invasive. You have an invasive surgery, whether it's a small surgery, but it is invasive. It's not the same as getting a hearing aid. A cross hearing aid does not give you sound back in your deaf ear. The implant is the only way at the moment of getting access to sound in the deaf ear, but it does require a lot of rehabilitation, a lot of work on the side of the patient. So there'll be lots of listening exercises. I will be going to my audiologist to have lots of mapping sessions, so having them fine tune the implant. So it's a big commitment, it's a big decision. So yeah, I just wanted to say that, because I have a lot of people contacting me talking like the implant like it's a hearing aid, like it's a quicker fix than it is, and it's not. It's, everyone says it's a marathon, it's a marathon, not a sprint.
Yeah, and I think to your point though, and what we've said before is that the are always individual.
Mm-hmm.
And some people, yes, could have this miraculous
Mm-hmm.
recovery after, and I've seen it because I've worked for a cochlear implant company, and as part of that, it's amazing. I had the opportunity to go to many implant activations for
Mm-hmm.
patients that have had hearing loss for all different reasons. And sometimes it's like nearly miraculous. It's amazing how quickly they get it back. And
Mm-hmm.
there are those cases where it takes some time, but even with the time, we do see improvement. Like if you look at the research, it's 18 to 24 months where you can still see improvement
Mm-hmm.
post-operatively. I think the most interesting case, and maybe this will give you some hope,
Mm-hmm.
um, I went to see an activation for um, a gentleman who was congenitally deaf. So he never wore obviously he never wore an implant. He wore hearing aids for a little bit, but really his main mode of communication was American Sign Language. And he was, I believe, like anywhere between 34 and 36. So his ears were deaf for 34 to 36 years.
Mm-hmm.
Um, he had married someone who was hearing, but she actually learned how to sign. So their main mode of communication was sign language. But she was pregnant. She was expecting, and he was anticipating the child having hearing. So his goal was to learn how to hear and learn how to speak alongside his baby. So as if he was like going through life, the hearing world with his baby.
Mm-hmm.
And we had warned him, like, this is a complete experiment. Like he knew that there was nearly a 0% chance that this was going to work or that he was going to get anything. And when he was activated and could hear, and you could just imagine what an emotional setting this was, because he came with his mother, who obviously raised him as a deaf child, which it comes with its own set of stressors. I have a lot of stories about that, but the wife who was expecting, and then him who started to hear again, and every sound was new. Every sound, the chair moving, the microwave going off, the toilet flushing, like everything. So he was really like a newborn baby hearing again. And the fact that he was able to hear and start to put connections, and he said that the most interesting sound to him was birds chirping. He didn't know that birds chirped.
Mm-hmm.
So that was like one of the biggest miracles I've ever seen, because we had no hope that it was going to work, and he knew that it was completely experimental, but he pushed for it. And like you said, advocate for yourself, and
Mm-hmm.
you never know. You never know what's going to
Mm-hmm.
end up happening.
Mm-hmm.
So,
It just shows that everyone's experience is different. There's only so much you can predict.
mhm.
Mm-hmm.
For sure. Yeah, and I mean we do look to the research, and obviously the research is important, but
Mm-hmm.
at the end of the day, each person is so different. And I know, Carly, you do a lot of writing about hearing aids, and obviously I do a lot of discussions about it, and there are so many options out there, and I think that there's so many options, and there are so many good options, because there are so many people, and each person is so individual that they all need something else. So what
Mm-hmm.
works for one person might not work for someone else. And so everyone needs a unique option, that is tailored to what their hearing needs are and what their hearing loss journey is. And yeah, it's interesting. I'm curious to know, how things will go for you. And I'm sure that that'll definitely be another podcast series as you go through your
Probably.
journey. Yeah.
Yeah.
And
Sorry, Ruth. I was just. It is. It's just. It really highlights that, if you tried one thing to help with your hearing, doesn't if it doesn't work, well, maybe something else will. So it's always worth trying something else, isn't it?
hmm for sure. And they're right. And not to give up in a way until really, all options have been exhausted. And
Mm-hmm.
the truth is there's so much available that and just seeking what options are out there, and never giving up on yourself. I think that's a confidence thing, and
Mm-hmm.
that's what I love most about what you do, is that giving the people the confidence to take those steps and advocate for themselves, and continue to
Mm-hmm.
search for what's going to be the best option for them.
Yeah, exactly. Yeah. And I think it's important as well to remember that with your hearing loss, you might lose some confidence, but actually you can gain confidence as well. I wouldn't have been doing a podcast before my hearing loss. There's no way. There's no way I'd have the confidence to do this. So, you can work with it, work with what you've got, and find the positives in your struggles, and come out the other end even stronger. Definitely.
I would agree.
Mhm.
I would agree. Well, it now I know a little bit more about your story, so it's very enlightening. I feel more connected to you. Hopefully the audience feels the same.
I hope so. It's been really interesting hearing yours as well, because there's so many gaps in your story, and I was like, oh, I wanted to ask you so many things, and it's been nice to hear a bit more today.
Yeah, the same. And we're happy to answer any other questions that maybe the audience has, or your group, your hearing loss group has. And I'm sure there are some things that we said that will spark up some more questions. So we're happy to answer those as they come.
Yeah, always happy to answer questions. Just get in touch and we will respond.
Sounds great. Okay, Carly, it was great speaking with you. Have a great rest of your afternoon. And until next time.
Thank you. Have a nice day.
Thank you.